Thank you for joining us. You are a part of an elite group who recognizes that Black women's health should be at the forefront of the national conversation. We are mothers, daughters, activists, entrepreneurs, entertainers, corporate warriors, and more, who help boost the economy and often drive the national conversation. For 38 years, the Black Women's Health Imperative has strived to amplify our voices, help enact policy that protects us, research our issues, create programs that enhance our lives, and produce events like this one to ensure we keep the conversation going about the issues that matter to us most. So, let's get started with our program.
Good evening. I'm Michelle McNeil Emery, a past president of the National Coalition of 100 Black Women, Incorporated, and the COVID-19 Partnership Project Director. On behalf of the Black Women's Health Imperative and its president and CEO, Linda Goler Blount, the Coalition's national president, Elizabeth A. Jones, and all of our members in 62 chapters in 25 states and the District of Columbia, as well as Rising Sun First Baptist Church, I am pleased to welcome you tonight to one of the many COVID-19 community conversations we've hosted since the start of the pandemic. Each of our community conversations has been designed to empower communities with the most up-to-date information available in order that they might make informed decisions to protect themselves and the ones they love. Tonight will be no different, but we'll focus on the city of Baltimore, where the rate of COVID-19 transmission is still high, and we are still struggling to get people vaccinated. It is our sincere hope that tonight's discussion will empower you to join us in the fight against the spread of COVID-19 in all of its forms. And now, I have the honor of introducing our distinguished moderator for tonight's discussion, Mrs. Candice Tolliver Burns, Chief Communications Officer, IDEA Public Schools, a proud member of the Coalition's Baltimore Metropolitan Chapter, and the First Lady of Rising Sun First Baptist Church. Candice?
Thank you, President McNeil Emery. It is always an honor to be introduced by my chapter president. So thank you for that gracious introduction. As shared, I'm Candice Burns, and I am First Lady of Rising Sun First Baptist Church, and I am your host for this evening's conversation, Steps to Surviving COVID-19 in the Age of Variants. When we think about what lies ahead of us, from our work to our worship, from our schools to our small businesses, from the enormous responsibility that we have for caring for our children, our parents, our families, and our communities, COVID-19 has fundamentally changed what we consider as safe and certainly changed how we engage in our daily lives. And just when we thought that the effects of the virus were subsiding, then emerged variants. Across the nation, the first month of 2022 was not easy. In Baltimore City and the surrounding metropolitan area, we experienced the highest surge of COVID-19 cases since the pandemic began in 2020. Yet the latest data affirms there is hope on the horizon. Here with us are a dynamic group of experts from medical fields, social action and advocacy, health policy, education expertise, who can speak to where we are now with the pandemic and give us some very concrete steps on how to move forward. I am very pleased to begin our conversation with Faith Leach. She is the City of Baltimore's Deputy Mayor for Equity, Health, and Human Resources. And Faith will kick off our conversation by sharing remarks on behalf of Mayor Scott. Deputy Mayor, thank you so much for joining us.
Thank you. We are now going into what, year 2, 3 of the pandemic?
Year 3.
I'm still forgetting to unmute. But thank you so much, Candice, and thank you guys for having me here. I want to bring greetings to everyone on behalf of Baltimore Mayor Brandon Scott. So as Candice mentioned, my name is Faith Leach, and I'm the Deputy Mayor of Health and Human Services right here in the city of Baltimore. I want to thank all of the partners, the Black Women's Health Imperative, NCBW 100, RSFBC, for sponsoring such a timely conversation. Before we get into the steps to surviving COVID during the age of variants, I first want to talk a little bit about how we got here in Baltimore. So pre-pandemic, Baltimore, like many cities across the country, had an underfunded local healthcare system. And while some of the best hospitals in the world call Baltimore home, our residents are still plagued with subpar health outcomes, driven by systemic, social, economic, and environmental obstacles. In Baltimore, where you lived, definitely determine your health outcomes. So pre-pandemic in Baltimore, life expectancy differed by up to 20 years between neighborhoods. Residents of some of our poorest neighborhoods were and still are plagued with higher rates of heart disease, diabetes, obesity, hypertension. 1 in 3 of our high school students in Baltimore is obese. At least 30%, and that number post the pandemic is so much higher than 30%. 30% of our young people have been exposed to some form of trauma. So imagine the state of health equity in a city like Baltimore pre-pandemic, and now you layer on COVID. But even with these challenges, our health department took COVID head on under the leadership of Dr. Letitia DeRaza and Dr. McDowell, who you'll hear from a little bit later. Baltimore has weathered this pandemic better than many similarly situated cities across the country, according to a report by the Johns Hopkins School of Public Health. Hopkins compared Baltimore to 325 cities with similar demographics. Of those cities, Baltimore ranked in the 97th percentile for the highest vaccination rate, the 81st percentile for the lowest number of cases, and the 73rd percentile for the lowest mortality rate. Dr. McDowell, who's going to be on the panel tonight, she's going to talk a little bit more about the data in Baltimore, and she's also going to talk about how we centered community voice in our outreach work during tonight's discussion. But for a city with a fractured public health system, we stepped up. In Baltimore, we have this saying that it's Baltimore versus COVID, and we mean it. Even with the latest surge, our city has weathered it together, and we are not letting up. So again, thank you for inviting me to join you on tonight's panel and this conversation. And I look forward to hearing the panel and also speaking with you too, Candice.
Thank you. Well, Deputy Mayor, we are grateful not only for you being here, but certainly the leadership that you have invested in the city of Baltimore. And certainly grateful for Mayor Scott for all that he is doing to keep hope at the forefront and certainly keep equity and access to treatment in the forefront. So, you know, I've been following everything that your administration has been doing, and I'd like for you just to really speak to, in the midst of this surge, you know, January has been unlike anything we could imagine it would be. How did your administration tackle addressing access to the vaccine, access to booster shots, access to testing? How did you tackle those things, particularly amongst communities with that very high transmission rate?
Yep. So I'll tell you, Candice, what we did is we prioritized those communities, right? That is the definition of equity. That is what equity is about. It's not equal distribution. It is targeting and ensuring that you have resources into those communities who have been disproportionately impacted. And so, you know, when we look at COVID and the overall impact on Baltimore and really the country, what we see is that Black and Brown folks were those folks who were disproportionately impacted by COVID. And so what we did through our health department, and Dr. McDowell will talk a little bit more about that, is we were data driven. Even though the Maryland Department of Health actually had a data breach. And so during the surge, we actually had limited data, but we still used what we had. We used the data from our healthcare partners and from our hospital partners, and we were driving our outreach to those areas where we knew that the vaccination rates were the lowest and the incidences of COVID were the highest. We also hired what we called value ambassadors, value community ambassadors, which essentially are public health workers. And those folks were people who were from the community. So we actually leveraged our Safe Streets program, which is our violence intervention efforts in the city of Baltimore. We trained Safe Streets workers, so that they also were informed and could communicate about about the vaccine and about testing options as they were out in the community. And then we also hired individuals who were from the community. And that is important as we talk about really overcoming challenges around vaccine hesitancies and some of the broader issues. We have to really center the community and center voice, but then we also have to be there to drive those resources to the community. In addition to really centering community voice and hiring outreach workers and really targeting resources to those communities, we also launched our at-home test program. And so what we did is we partnered with libraries and also community-based organizations, those organizations who are on the ground, who can get to those communities who might not go to a government building, they might not go to a testing site or even a library. And so those organizations were able to pick up at-home test kits and distribute them along with masks to the community. And then the library was one of our main partners. And so they also were distributing at-home test kits out in the community. So, you know, when I talked about early in my remarks that like we weathered this together as a city, we leveraged all of our anchor institutions, all of our partners, our grassroots nonprofit organizations to get the resources to the communities that needed it most.
So I'm going to use an old church phrase that I'm sure many of our viewers have heard before: each one, teach one. You know, as we close out, tell me, what do you want to leave our viewers with? You know, you've got access to community centers, you've got testing, connecting with libraries, you're bringing resources directly to the people who need it most. What do you want to leave with folks? What message do you want to leave with them to say, hey, look, here's what's most important as we're tackling this surge right now?
Yep. I think what is one of the most important things that anyone can do right now is to get vaccinated. And to have those tough conversations with your family members and with your friends who still at this point in the pandemic have not gotten vaccinated. In Baltimore, because we are the home to some of the world's best hospitals, our hospitals have been overwhelmed. They've been overwhelmed with patients, not just from Baltimore, but all over the region who are coming into the city of Baltimore to get the best care possible, right? And so I think the biggest lesson and the biggest message here, and I'm sure the panel is really gonna hone in on this even more, but it's get vaccinated. And I'll end with a personal story. I actually shared this story with the mayor as we were discussing additional protocols and options to put in place to really kind of defer the surge. But I shared this story about my brother. And so my brother actually lives in New York, and he is in his 30s, and he has very bad asthma. And so one night, he works late into the evening. One night he texts me at 2 a.m. I happen to be up. I text him back. He called me. We had an hour-long conversation about his hesitancy around getting vaccinated. And I will tell you that it was the most important conversation that I could have had. And it wasn't a conversation that I initiated asking questions. I was there to be able to quell some of those myths, quell some of those things that were coming up. And, I think the headline there, even in my conversation with my brother, is that you have a comorbidity, right? It is more important for you to get vaccinated than it is for other folks, right? Everyone needs to get vaccinated. And so what I communicated with him, and he ended up getting vaccinated, and I'm so happy that he was able to get vaccinated, is that, you already know the impact of your asthma and how it has you in the hospital every year. But what we know is that if you get vaccinated, you have a lower chance of actually passing away because of COVID, right? And so being able to share the truth and to be truth tellers to our communities and to our siblings and our family members and our partners. I think that is the headline that I want to leave with folks today, is that it is incumbent upon all of us to be truth tellers about COVID.
Deputy Mayor Leach, thank you so much, first and foremost, for prioritizing closing the equity gap, closing the information gap, and reminding us that, we can't give up on our friends, our family, our colleagues who may have that hesitancy around vaccinations. We've got to keep talking to them because, only when they're healthy and safe, we're healthy and safe. So thank you so much. I've really enjoyed talking with you. I know it won't be the last time.
Yes, thank you, Candice.
Absolutely. All righty, so we have a dynamic panel. We start off strong with our Deputy Mayor Leach, and now we are going to move forward with a roster of panelists who cover everything from the medical field to the education field, certainly to healthcare policy. We have Dr. Tedric Henneghan. He is the Chief Anesthesiologist for the University of Maryland Medical Center, Midtown campus. We have Mr. Sidney Evans, Executive Vice President of Finance and Administration, Morgan State University. And we have Dr. Kendra McDowell, Chief Medical Officer, Baltimore City Health Department. Everyone, thank you so much for joining us and lending your voice and your expertise to this conversation this afternoon. So I'm going to start with Dr. Henneghan. There's a lot of, misinformation or maybe even some confusion around exactly what are variants. So let's talk about variants, and particularly from your lens. Why did the Omicron variant surge so rapidly? Why is it more transmittable than other variants?
Thank you, Candice, for having me.
Absolutely.
As you know, with viruses tend to replicate, viruses tend to change, especially as they sort of are introduced into the population. The first variant that, we saw was the Delta variant. And as you saw, it sort of interacted with people in a sort of different manner. But as viruses are around longer, they start to change and they start to adapt sort of to everything from their environment they're in, including, drugs that are, that they go up against, or just people's host systems. And so viruses are pretty smart. So they try to adapt to their surroundings in order to survive themselves. And so this time we saw with the Omicron variant, as you know, compared to the Delta variant, was much more contagious and infectious than the Delta variant. And as we saw, it sort of peaked at a time where we're coming out of the summer, going into the winter months and around the holiday time. And just socially around that time, there are gatherings, whether it's Thanksgiving, whether it's Christmas, people are getting together. And, compared to when we had the Delta variant, some people had been vaccinated, and so they felt a little bit safer about being around family and around friends. Mm-hmm. But as you saw with those gatherings, the spread sort of multiplied and increased rapidly. And so it got to a point where, because of the infectious nature of the Omicron variant, that the surge actually was a little bit more impactful than it was with the Delta variant. And like I said, because of the gatherings and people just being vaccinated, and of course there were people who were unvaccinated. And as the spread started to happen, the people who were unvaccinated sort of started getting more of the sort of sicker of the patients who were infected. And those are the patients we started to see started coming into the hospitals and started coming into emergency rooms and into the ICUs.
So, we've seen the data in the news reports that have come out, the data from our local health care officials, and we understand that hospitals were at full capacity. And a vast majority of those individuals who were coming through your hospital and others were unvaccinated. Tell us what it means when nearly every bed is filled with a COVID patient. How does that impact the healthcare system? Right.
And it's a very stressful situation because the hospital has its sort of daily mission of taking care of, healthcare problems. And these healthcare problems range from, the fight against heart disease, the fight against cancer, the fight against diabetes, hypertension. And these are sort of baseline problems that the hospital, takes on as a mission. And so when you get something like the Omicron variant, and then you have an influx of patients coming into the hospital, and now you have a limited amount of beds, So with the limited amount of beds, now you're not able to sort of carry out those missions, that the hospital had before. And as I saw in sort of our practices, a lot of places ended up having sort of limited usage as far as personnel within the hospital. So what we had to do in a lot of places is that we even had to reduce, in my case, like operating room time. So people who were scheduled for surgeries, because of the number of beds that were taken up, we had to decrease our volumes in order to accommodate the beds that were needed for our COVID patients. And so a lot of people who needed to have certain surgeries had to be delayed. And because of that, a lot of things got put off. And so because we just didn't have the beds to accommodate, the patients that we need to take care of. And so it put a big strain on the hospital. And so a lot of these patients came in, took up not only regular beds, but ICU beds. So critically ill patients who didn't have COVID, it was a sort of a chess match trying to figure out how do we place these patients into these critical care beds when they were occupied by a lot of our COVID patients. And so within our system, there's a lot of shifting around of patients between different hospitals who either had higher or lower numbers, just trying to accommodate, the amount of patients that were coming in with the COVID variant.
If we could just dig a little deeper about the individuals who were coming through your hospital, the Midtown campus, at the very peak of the surge, what did they look like? Young, old, seniors, young adults, children? Tell us, who were you seeing?
So we're seeing a lot of sort of our younger patients. When I say younger, between the ages of 30 to maybe 45 or so coming in. And a lot, like I said, we're unvaccinated. A lot of our older population, because, they were fearful because they were in the older population, were vaccinated. And so we saw a lot more of those who were unvaccinated in that age range. And a lot of times, there were a lot of questions I know within that group of people about, whether vaccines were safe, whether the vaccines were rushed. That's why they sort of held out, or they've made it this far, so therefore, if I made it this far, I should be okay. But we found that with this new variant, that a lot of them were not okay, and they got infected and came into our hospital. And so a lot of those patients were coming in who sort of, especially the ones who got really sick. And you would hear stories of people saying, wow, I wish I really would have gotten the vaccine because I didn't think it was going to be this bad. And at that point, it's a little too late. And given my position, especially when we had the Delta variant, I was the one sort of responsible for sort of intubating a lot of these patients, when they had respiratory distress and had to be put on ventilators. When you look down, before I performed that type of procedure and I looked down, a lot of those people look like me. And we're sort of in my age range or younger, a lot of times the questions would go through your heads like, why didn't you? Or why didn't you, take the necessary measures to stay safe? Or why didn't you get the vaccine? And so you wouldn't be in this situation. And a lot of our healthcare providers, whether it was ICU nurses, whether it was, other hospital personnel, when you see patients, especially now after the vaccines have been made available, when you see the ICUs overrun with patients and another patient comes in and the ICU asks, are you vaccinated? And they say no, you can kind of see the sort of the despair on their faces. It's like, you could have prevented a lot of this, and, had you just gotten vaccinated.
So I remember in one of our earlier conversations, you said to me that a large majority of the individuals that you saw come in during the peak were young people. They were young adults. I would even venture to say they might even be college-aged adults. And so, Mr. Evans, I really think about the enormous responsibility that Morgan State University has in terms of creating a sense of safety and confidence, not just for your students and your staff and your faculty, but certainly those parents who are entrusting their children with your university and may have a bit of angst, but they're sending their kids to school and they're allowing them to stay on campus and to go to school in person. Tell us a little bit about how Morgan State University has really created that high standard of safety so that students and staff feel comfortable coming back in person.
Well, thank you, Candice. And before I start, I would like to thank NCBW RSFBC for bringing this very important topic to the city of Baltimore and all of those that are watching tonight. On behalf of President David K. Wilson, the Board of Regents of Morgan State University, we are all very pleased to participate in trying to learn more about how to protect all of us in this very difficult moment. Since the onset of the COVID-19 pandemic, Morgan has assumed a leadership position and maintained a proactive stance with regard to implementing mitigation efforts to safeguard the Morgan community. Let me underscore that, safeguard the Morgan community against the spread of the coronavirus and its variants. President Wilson, under his leadership, mobilized the Morgan Campus Health Monitoring and Response Team. I know that's a lot. We call it the MCHMRT. And this team was made up of representatives from across the university community. It was a transparent, inclusive approach to mitigating efforts against the coronavirus. The chair of this response team was one of Morgan's noted professionals in the area of public health, Dr. Anita Hawkins. She is the Associate Dean of our School of Community Health and Policy, which is one of our esteemed 10 schools at Morgan State University. In addition to Dr. Hawkins, we also had the Vice President for Student Affairs, because at the end of the day, this is about our students. And Dr. Kevin Banks, our Vice President for Student Affairs, was co-chair with Dr. Hawkins. Under the leadership of these two professionals at Morgan, this response team instituted the following measures: enacted a twice-weekly testing protocol, mandated vaccinations for the entire campus community. And today we are encouraging booster vaccinations as well. We also instituted required indoor mask wearing, adhere to safe social distancing practices, for example, reconfiguration of classrooms, and introduction of both remote and hybrid instructional modalities. We have spent almost $4 million retrofitting our classrooms in order to provide remote and hybrid instructional modalities. We also established quarantine and isolation practices for students in congregate living within campus facilities. And we've instituted ongoing sanitation of classrooms, academic buildings, residential facilities, and common areas, including the placement of sanitation stations and campus buildings, distribution of care packages to students, faculty, and staff, and face masks and hand sanitizers. While this was a very difficult situation and problem that we faced at Morgan State University, but from the onset of the pandemic, we hired a third party to come in and disinfect every facility after we went through a period in March, April of 2020 to safely remove all students, faculty, and staff from the campus to get everyone home safely. And while the university was open during this time, the campus was closed. Safety of our Morgan community was our number one priority. And we spent the entire summer working through a number of these activities that I just mentioned to ensure that the campus would be safe when we returned. However, we didn't know when we were going to return. And the start of fall 2020, we did offer remote and online classes, and we reopened in the fall of 2021.
You know, Vice President Evans, I was taking a few notes here and I heard all of the different safety practices that you ticked off. Yeah, vaccinations, testing, mask wearing, social distancing, healthy hand hygiene, building sanitation. Dr. McDowell, correct me if I'm wrong, but much of these practices and kind of the standard that would, kind of blanket the city and surrounding areas is driven by the data that comes out of your office. Talk to us about, where we stand now in the city of Baltimore. What does the data look like? We know that January was one of the highest, if not the highest we've had since March of 2020. But where are we now? Because we're hearing now that perhaps transmission rates are down. We've heard that there's a decline in hospitalizations. So where are we now? And how does the data shape the policy that comes out of your office?
Thank you so much, Candice, and also the Black Women's Health Imperative for this opportunity. As you mentioned, right now where we are as a city, our cases are coming down, so our cases of COVID-19, and also our percent positivity. So right now our percent positivity is around, it's less than 5%. It's around 3%. That is a great thing. The percent positivity are the percentage of tests that come back positive within a day. And we want to see that less than 5%. We are still seeing high hospitalizations. Hospitalizations and deaths are a lagging indicator. So what happens is people are infected, and then a couple of days later, possibly because they might be unvaccinated, they might have an underlying medical condition, or they might be immunocompromised, which puts them at increased risk of COVID-19. Some of those individuals will end up in the hospital. And then after that, of course, some of those individuals, unfortunately, might pass away. Currently, what we are seeing in the city is that in the setting of the Omicron surge, we have our hospitalizations are 2 times higher than they were from our prior peak. And it's the same thing with deaths as well. Our deaths are 5 times higher. Sorry, not our deaths, scratch that. Our COVID incidence is 5 times higher than what we were seeing in the prior peak. And we are seeing a high number of deaths. This is actually a national trend. We're seeing this across the nation, across Maryland, and also in the city, where we're seeing high number of deaths, even though, as Dr. Henneghan mentioned, the Omicron variant is milder in those individuals that are vaccinated and boosted. So that is the most important thing, in those individuals that are vaccinated and boosted. If you are not vaccinated and boosted, then we are seeing severe disease from Omicron. We are seeing death from Omicron. The vaccine plus the booster works. CDC just had a study that came out in the MMWR yesterday that showed that individuals that are vaccinated and boosted, so had their 2 doses of Pfizer or the Moderna vaccine and then received their booster, were 23 times less people that were unvaccinated were 23 times, had a 23 times higher rate of hospitalization than those that were vaccinated and boosted. So these measures are extremely important. As Dr. Henneghan mentioned, practicing physician, what we're seeing in the hospital system, he said that what we are seeing is our young people, 20 to 40, being hospitalized. And that's what we're seeing in our data, is that the individuals that are least, less vaccinated in the city are under 35. And so in terms of your question about how we use data to drive decision-making, to drive policy, mitigation measures, as Deputy Mayor Leach mentioned, specifically, using our vaccination campaign as an example, early on, we decided to focus our vaccination efforts in communities with low vaccination coverage, in communities with high COVID incidents, to make sure that vaccination access was equitable. We also did that with outreach as well, because you can have a vaccine clinic somewhere, but one, do people know about it? Do they trust the clinic? Do they feel comfortable? Are there questions getting answered? So outreach, we currently, through that Vaccine Peer Ambassador program, our value communities, we go out into the community and we talk to people. We have town halls. Same thing with our vaccination clinics. And a number of our partners, University of Maryland Medical Center, Morgan State University, our Baltimore City is such a rich academic city in terms of institutions, and then also its healthcare system and community organizations, that we've been able to leverage that along with the data to say, this is what we're seeing, this is how we need to iterate and pivot so that we make sure we are reaching those populations, those communities that need the access and need the information.
So I think it bears stating this statistic again, because it's jarring, and anyone who's not vaccinated should hear it and consider this. Those who are not vaccinated are 23 times more likely to find themselves sick and in a very, more susceptible to illness if they are not vaccinated. 23 more times, at risk of getting sick if they're not vaccinated. So I think that is just a tremendous thing to consider. I also want to make sure that our viewing audience knows that you all can drop your questions in the chat. Please share with us your thoughts, recommendations, observations, and comments. We want to share those with our guests and to respond to them during this conversation. So I'm really struck by this. You're clearly at risk if you're not vaccinated, but we have a large swath of individuals who are still not getting vaccinated. And so, I hear there's a lot of issues around trust around the vaccine, or, I've escaped hospitalization, or I'm not sick, so far. So why should I do it? I'm okay. What would you all say to someone who's saying, well, I've made it this far, what should I do now? What compelling information, and that statistic was really compelling, but what do you say to someone who just is resistant to getting vaccinated? And Dr. Henneghan, I'll start with you.
I would say is that, part of this is also not just about you, but about your community and your family and the people that you interact with. You may be young and, you may get the Omicron variant and be asymptomatic, but doesn't mean that you go home and you pass it on to your parents or to your sister or brother, and they may not be asymptomatic and they may get severe disease and they may end up in a worse state than what you were. And so just because you've gone this far and you haven't gotten it doesn't mean that you still can't get it. I mean, Omicron, the COVID is going to be around for a while. It's not going to go away, just overnight. So the chances of you still getting it are still very high. So why would you sort of take that risk when you have an opportunity to sort of increase your odds at one, not getting very sick, and two, protecting the people around you?
Vice President Evans, what's working on the campus of Morgan State University? Is it peer-to-peer conversations? Is it a a mandate that you have, if you're going to come to school and learn in person and be on campus, you've got to be vaccinated. What's working with individuals that are college age, 20 and younger, or within their 20s and 30s?
Well, I think it's all of those things that you have just mentioned. And I would agree with Dr. Henneghan that it's about the community. It's not about the individual. And believe it or not, our students were ready to come back to Morgan. They were living at home or with their relatives or what have you, but they were very excited to come back to Morgan. However, given the environment, we made it very clear we have to protect each other. And it is about the community. And I think one of the really positive things we've done at Morgan under Dr. Wilson's leadership is the transparent and inclusive approach to dealing with all the issues. We too communicate the data. We have a high percent of students that live in congregate living that are vaccinated. We have a high number of faculty and staff that are vaccinated. And as a critical partner in the city of Baltimore, we also partner with the Maryland Department of Health and the Maryland Equity Task Force to host a vaccination clinic. So this was important to our students to see that Morgan established a vaccination clinic for the city of Baltimore. That's another example about community and being safe. Believe it or not, we have record enrollment at Morgan this fall. We have the highest freshman class in the 155-year history of Morgan State University. I think that demonstrates that Morgan is truly a family, truly a community, and is very serious about keeping all of us safe. And I think that has made a difference. And President Wilson has town hall meetings. We are constantly meeting with our student leadership, the SGA, the graduate student SGA, and we have all agreed this is the right thing to do for the Morgan community.
Dr. McDowell, for those who can't really wrap their heads around, I'm 23 times more likely to get sick if I'm not vaccinated. Oftentimes that peer-to-peer or that partnership or that community leader, someone who really is influential, who has credibility, is really the one who can tip the scales. So I know that your office is responsible for just a range of partnerships. Can you talk a little bit about that?
Yes. In terms of tipping the scale and having those tough conversations, I see that was a question. These are hard conversations to have. The Baltimore City Health Department, in partnership with Johns Hopkins IVAC and Morgan State University, have developed the Value Communities model, this vaccine peer ambassador model. And through that model, it is peer-to-peer conversation. So we hire, qualify, and train individuals from the community, from the value community that they represent, to have these tough conversations and to be up to date on the vaccine science, to be trained in motivational interviewing. And I will provide an example. I know Deputy Mayor Leach mentioned Safe Streets. So Safe Streets has been a great partner with vaccination work and also with testing as well. And we had a roundtable with Safe Street workers, and people shared their experience about getting vaccinated, one-on-one talking. It was moving. Individuals, when you're talking to someone that looks like you, shares your same, maybe you work in the same place, come from the same neighborhood, you're willing to share a little bit more about your desires for the future, about your fears, and about your hopes as well. And those are the things, and I'm sure Dr. Henneghan knows this, but in the clinical setting, those are the conversations that really change someone's outlook. It might change their behavior, might make them more willing to take the medication or exercise daily or get vaccinated. So it takes time. You know, it's not always you have one conversation and it's one and done. Sometimes it takes coming back to that doctor's office and asking again. It takes coming back, you know, you're talking to a friend, they might initially be hesitant. It takes coming back to them multiple times. And the trust is huge. We did, through our value communities work, early on when the vaccine first rolled out. So January of 2021, February of 2021, we did community listening sessions. And again, with Morgan State, with IVAC, and with MICA. And really just sat and listened to people. What were their concerns? How were they feeling coming out of we weren't out of the pandemic. We thought the vaccine was extremely hopeful then, and it still is. But, you know, what were their hopes and fears? And a big one was, you know, trust. I don't trust the healthcare system. I don't trust the Baltimore City government. I don't trust the federal government. These were real things. And so to build trust, you know, I always said it doesn't happen in a day, it doesn't happen in 2 months, 6 months. It takes years to rebuild trust. So that's something that that peer-to-peer really helps with that trust building. And also coming back to people and not giving up on individuals and really getting at what is the core reason, their motivation just for life and living, and the core reason why they are hesitant about the vaccine, and working through that with them, and then providing access as well.
You know, trust, you know, really comes from people feeling as if they're in a community that is really invested in them, that has their best interest. Trust also comes from, you know, being armed with information. So I know one of the questions that we've gotten repeatedly in the chat, and I know I've received it here at Rising Sun and elsewhere, is, you know, okay, I haven't gotten vaccinated. I think that I should get this done, right? But which one should I get? Moderna, Pfizer, what's the difference? Even that can be an impediment to someone going that next step and getting vaccinated. Please, you know, Dr. Henneghan, if you could jump in and tell us, and then Dr. McDowell, you know, any thoughts on those two vaccines, Pfizer and Moderna?
Yeah, I would say that, I mean, both are equally sort of effective. And if you have an opportunity to get either one, you should get, you know, get either the Moderna or the Pfizer. I know even within the hospital where I work, initially there were a lot of Pfizer vaccines available, and Moderna sort of came along later. And so everyone who got the Pfizer vaccine has done fine, and everybody who's gotten the Moderna vaccine has done fine. So I would say if you have an opportunity to get either, whatever is available to you, you should get.
Yeah, yes. And wanted to also say, get the booster as well. So that 23 times, like that 23 times higher rate of hospitalization is compared to unvaccinated people compared to those that were vaccinated and boosted. So right now, especially with Omicron, you need the booster to get that higher protection, that optimal protection from the vaccine, and to stay out of the hospital and to not have severe disease. But like Dr. Henneghan mentioned, the Moderna, the Pfizer vaccine, they're both messenger RNA vaccines. They're both highly effective in preventing severe disease, hospitalization, and death from COVID. Same thing with the booster. You can get the Moderna or the Pfizer booster. You can even mix and match. So let's say, you know, you initially got the Moderna for your 2 doses, and you go to a clinic and they only have Pfizer, it is okay to get that Pfizer booster. Same thing. Let's say you got Pfizer for your first two. It's okay to get the Moderna booster. It's the efficacy, the effectiveness, how well the vaccine works it's basically the same.
And how about this thing? I'm boosted, I'm vaccinated, I'm fully vaccinated, and I'm boosted. Do I need to wear that mask?
Yes, I tell people just because you're vaccinated doesn't put a bubble around you. You can still get the virus. The key is that you don't end up in the hospital severely ill. You can still be a carrier, and so you can still transmit it to someone else, within a community. So it's important still to wear a mask and still practice proper, hand hygiene and those safe practices that we initiated in the very beginning.
We just received a really interesting question about this concept around new normal. And I can't recall, but one of you all shared that, really, we're going to be living with COVID-19 for some time now in some way. So this idea about wearing masks and social distancing and practicing hand hygiene and all those core safety practices aren't just something that we'll use during a period of time, but those will become part of our just everyday normal routine. Vice President Evans, you're on a campus where students are together every day. They're in dormitories, they're in classrooms. How have you all created, how does a new normal look like on the Morgan State University campus? And how does it still feel like that awesome HBCU college experience, even in the midst of COVID?
Well, one thing, we will continue that great HBCU college experience at Morgan, but you make a great point, and we are experiencing a new normal. That's why mandatory negative test results, vaccination boosters, mask. We have bought thousands of N95 grade masks, and we work very hard to continue the open dialogue and the communication with our students. I mentioned Vice President Banks, our Vice President for Student Affairs. He is constantly working with our student leaders and trying to understand that we have to do the right thing, such as get vaccinated, receive boosters, so that we can move to a safe environment. As I mentioned, we have record enrollment, so we have more students on campus than we've ever seen before. So this is a challenge for us. But I think with the inclusive approach that we're taking to educate our students and to recognize it's about the Morgan community, it's not just about you as an individual. And we want to continue to experience all the great things that Morgan offers. I mean, we still have our athletic contests, and we're looking at partnerships so that we can create additional venues within the city and across the city to give our students an additional outlet. One of the things that has challenged Morgan and other historically Black colleges is resources. A lot of the efforts and activities that I've talked about did not come free. Fortunately, because of a number of stimulus programs from the federal government and the most recent American Rescue Plan from President Biden, it has enabled Morgan to make the right decisions and think about how we pay for it later. So we are very focused on trying to do the right things for our students, faculty, and staff, and we have been able to use the federal dollars in a way to advance the programs and activities moving forward. We're not where we want to be with our students. However, I think the students have confidence in the administration and know that we're working very hard to establish the new normal at Morgan and also keep our history and legacy about the Morgan experience.
You know, this conversation I knew would go a lot faster than I wanted. There is so much good information that we need to share, and there's so many questions that people have around COVID-19, because ultimately we want to come back together. We just want to come back together safely. Dr. McDowell, can you share with us, you know, for our Baltimore City residents, what are some of the best places we can go to get these core safety pieces of information? Everything from where can I get free mask or free test, or where can I get vaccinated?
Yeah, so in terms of resources in the city, in Baltimore City, you can go to coronavirus.baltimorecity.gov, and we have information on our weekly vaccination schedule. We have vaccination clinics because of our multiple partners, mostly 7 days a week throughout the day, and then also where you can go and get tested throughout the city. As mentioned, we have partnered with the libraries, and additional partnerships are through our CBOs as well. And that is all on our website. Other places where you can go, and maybe I should drop this in the chat box. I don't know the number off the top of my head, but we also have a BCHD call center as well. So if you don't have access to the internet, you can also always call. And Candice, I'll drop that in the chat box, and we can definitely say what that is, that number. Lastly, other information, go to CDC's website. So the CDC has updated information. It's written in very clear language for the community on masks. Which masks? I see there's a question about which masks are the best. KN95 mask, how to wear how to wear a double mask, so a surgical mask and a cloth mask on top, or a KN95 mask or N95 mask to make sure that you have the proper fit. Like a KN95 or an N95 are going to provide you with the highest level of protection. So that's what I recommend: CDC, coronavirus.baltimorecity.gov, and then the Baltimore City call center number, which is, let me just quickly find it.
This is good information, so we'll take a moment.
Yes, our call center number is 443-984-8650. Again, the number is 443-984-8650. I do want to mention we also have a homebound vaccination program. So if individuals are mobility limited, are homebound, regardless of their age, they can call that number, 443-984-8650, and make an appointment to get vaccinated. Also, we have a program for individuals that might be mobility limited or homebound and need a test kit. You can call that call center number, and they will connect you to the organization that we have partnered with, CivicsWorks, to get that test kit to you.
Well, Dr. McDowell, Dr. Henneghan, Vice President Evans, this will not be the last time that we come together and talk about this important issue, because I've got at least 5 questions that have come through my cell phone, not even in the chat. Folks still want to engage in this conversation, but I think most importantly, they're committed to being safe. And we feel empowered when we have the right voices at the table, when we have the right partnerships at the table, so that we can truly pull our resources, help each other, and keep each other as safe as possible. On behalf of the Black Women's Health Imperative and the National Coalition of 100 Black Women, and all of us at Rising Sun First Baptist Church. We are so grateful that you've invested your time with us this evening. I feel more informed, and I feel like I've got some good news that I can share with someone else. I also want to thank President Michelle McNeil Emery of the Baltimore Metropolitan Chapter, and also thank Deputy Mayor Leach for coming and joining with us. You know, I'll tell you, there was so much good news that came out of this, even though we are certainly still in the midst of a challenge. We're still navigating our new normal. We're still figuring out how to best corral all of our resources so that we can truly stop the surge and live beyond COVID-19. But here's what I heard loud and clear. It takes every tool in our toolbox to keep our community safe. Get vaccinated. When you're vaccinated, it significantly improves your chances of staying safe and keeping those whom you love safe. Get boosted. This virus is evolving, and we've got to evolve our approach as well. And we know that when we're boosted, that's that extra layer of protection that, again, keeps us safe, keeps our family members safe, keeps our community safe. And I think most importantly, we've got to continue to work and just bond together. We are stronger together, and certainly this conversation is a testament to that. I am so happy that you all allowed me to join you this evening. I've enjoyed this conversation, and we're going to keep the conversation going. Have a good evening. Thank you.